Hypertension or high pressure, same thing. It's called a silent killer because often the patient is unaware that it's happening. Okay, so blood is under pressure because during the systole, the ventricles contract, and especially the left side, patient's left side, enormous blood pressure because we got to drive that blood all the way to the toes, fingertips, tips of the nose. Okay, so you get the idea. Diastole is the resting phase. All right, and we measure both of these because it's important to know that the heart is resting as well. One of the problems with hypertension is there's little tears, and our body is going to patch those tears. And as it patches them, we're going to develop a plaque, which is a topic we're going to hit pretty soon. Standard 120/80, but believe me, this is not for everybody. There's very large people that they're going to be like 160 because a large body requires a lot of pumping action. Yeah. And a small body may only have, 100, 110. You get sometimes a patient that's 90 pounds, sometimes an elderly person, 90 pounds. They seem to live forever because their heart doesn't have to work very hard because their body, delivering blood in that little tiny body doesn't take much work. All right, there is some problems with having a large body because it does tend to shorten our life because of hypertension. All right, but we need to know these numbers. 120/80 is the standard. Systole over diastole. Positive feedback loop. Okay, the problem with hypertension is, we call that BP or blood pressure. There is going to be injury, I mentioned, to the endothelium in that little video. And all those little plaques that are patching the tears, they're going to harden the vessels. And now our blood vessels don't expand like they should. They're rigid. And so the heart has to pump harder. Higher blood pressure, we get this positive feedback. Positive is not a good thing in this case. Strokes, heart attacks, I'll talk about some of this coming up. Okay, 120 I mentioned, and 80 is the standard. You see a lot of variation in this though. But when we start seeing above 140, and their history shows this is new, then we call that stage 2. Above 180, I'm telling you, for some people, they run 180 and they're okay. All right. Sometimes the elderly patients, they kind of need to be up there a little higher than normal. All right, but these are the standards we need to know. Aneurysm is often due to hypertension because it's a bulge. The aortic is one, it's below the kidneys here. But we can get aneurysms anywhere there's an artery under pressure and the wall thins. And the problem occurs when it bursts, sometimes life-threatening. Hypo means low blood pressure. And most of us experience orthostatic. You stand up really quickly and you feel dizzy. That is an example of transient or temporary hypotension. But we do need to pay attention to it because it can become serious, especially below 70. All right, and most of us have had experiences of hypotension before. Sometimes, the blood sugar is dropping, not enough sleep, medications, shock, all kinds of things bring us down. But at some point, we need to do something about it. All right, it can become a medical emergency. Atherosclerosis, that's what that first video was about. And the story is little tears, little microscopic tears from hypertension or from irritation. It's one of the dangers of smoking. Some of those chemicals in cigarette smoke are going to irritate and damage that endothelium. It's a very fragile lining. And so our body responds and says, hey, let's patch it. And we patch it, but we go too far. And we have foam cells in there, cellular debris. And look at this patient. Oh my gosh. There's the lumen. That's where the blood is flowing through. But originally, the blood vessel is very large. But this is all atherosclerotic plaque. All right? And we can avoid some of this, but it is a process to some extent. One of the reasons to eat roughage, the rough greens and other things, foods you have to chew that are coarse, is that it supports bacteria in the colon. And what these bacteria do, here's the story, is they're going to help the body, such as the liver, to process out the low density lipoproteins. These are the lousy lipids that are in our bloodstream, and these are the ones that are going to end up in the lining of our blood vessels. And so let's just expel these buggers out of the body, and bacteria help us to do that. Right? It's one of the good reasons for paying attention to diet. Look at this lumen. This poor patient probably was dead when this was taken because the extent of atherosclerosis is impressive. All right, when we're healthy, our blood vessel is very smooth. But let me show you what happened. Yeah, here we go. The problem with these plaques is they're not smooth, they're rough. And so watch what happens. Cellular debris is going to collect and the fibrin net, and now we have a crisis. All right, so we need to can with our diet to reduce and hypertension. All right. Okay, angina is just a symptom, chest pain. But it's a symptom of something possibly serious. It means that there's a coronary artery that is blocked. Okay, angina is not always due to that, but this is what I'm talking about here. And so it means wastes are building up, there's not enough glucose or oxygen, and the pain is because these muscle cells are screaming for their life. All right, and there's ways to treat this I'll be talking about. Other symptoms: nausea, confusion, radiant pain. Sometimes the patient will say, oh, I feel like someone is standing on my chest. All right, so it's not always just chest pain. Thrombosis. Okay, what a thrombosis is basically what I've been talking about. The atherosclerosis produces this plaque, and if that plaque is blocked by embolus, a chunk of plaque breaks off and floats. And this is why sometimes people, they're on an airplane for 18 hours, and that's too long, okay? Blood needs to move, and they get clots. DVT is the acronym for deep vein thrombosis. Embolus is that moving clot. Gangrene is a sad situation. It shouldn't happen, but sometimes homeless people or people who don't want to leave their homes, okay? I know I was an emergency medical tech, and sometimes it was shocking. I go in people's homes and I would say, oh my gosh. So what's happening is the same story, atherosclerosis, and over time the tissue starts to die, and it's the bacteria get in there, and they start to devour the dead tissue. All right, very sad. Congestive heart failure, CHF. All right, this is one of the problems with smoking or exposure to irritating airborne particles, is that over time this myocardium, which is the muscle of the heart, becomes damaged, and so fluids start to build up. And that's what this ankle is all about. When you see someone generally older, elderly, then with swollen ankles and they have a history of heart disease, you can guess that they have CHF. Fatigue, dependency on oxygen supplementation. All right, so they have a tank with a nasal cannula that they are on it for life. Okay, there's not much to be done about this except make them feel comfortable. AMI, acute myocardium infarction. Infarct means dead. Now, penumbra is tissue at risk. And so we want to save that tissue. And there's ways to do that I'll be talking about. Transient, I'm going to get to that, but let's talk about, TIA, because sometimes that's a temporary blockage. And so the tissue is in pain, okay, signals are sent out, but it's not dying. There's an ischemic stroke where there's a full blockage. Okay, what do we look for? Loss of balance, vision, uneven face. These are sudden, right? Arm weakness, slurred. Now, slurred speech can be due to all sorts of things, diabetes, or low levels of blood sugar, oxygen. I mean, slurred speech is a hard one, alcohol consumption too. But if all this is real sudden without any reason, then we suspect, especially someone elderly, we suspect TIA. Symptoms, I mentioned that these are the important ones here. Okay, thanks for listening.